Hello, so this is my portfolio assignment. So first, a little overview of the research questions I used. The first one I used is how is mental health affected by recovering from an orthopedic injury? Some main takeaways I found while researching this question were that mental health is an important yet under-addressed topic in orthopedic settings. So even though they highlight the importance of addressing mental health with orthopedic injuries, it is still not addressed and assessed as it should be. In the studies that I found, most patients reported wanting their mental health to be addressed. So this highlights the need for mental health to be addressed from patients and a recovery standpoint, but it's just still not being addressed. So most orthopedic clinicians also reported not feeling qualified, trained, or confident in assessing and addressing mental health. So this kind of is the big reason why there is a lack of mental health assessment and resources in orthopedic settings due to the clinicians not feeling like they are qualified to or they have enough training to or time. Lastly, I just wanted to highlight that traumatic injuries can lead to worse mental health outcomes. So this is important when treating traumatic orthopedic injuries, that they are more likely to face mental health issues. The second research question is how is mental health affected in elderly individuals with cognitive disabilities? So from these studies, the elderly with cognitive disabilities often reported lower satisfaction with healthcare. This is due to sometimes there's a lack of empathy and patience for patients experiencing cognitive deficits. The third research question I researched was what is occupational therapy's role in improving mental health? So the role is important, or the takeaways that I found in this were the importance of collaboration between different professions on addressing mental health. So there was one study that talked about collaboration between school counselors at colleges and occupational therapists to promote a better transition as freshmen in college move onto campus, since that is a big life change in situation to promote better mental health outcomes and reduce isolation. Another takeaway is the lack of standardized methods used to assess mental health due to lack of time, training, and confidence of clinicians, which leads to them relying on unstandardized methods. So this is a big takeaway because as clinicians, we do want our treatment and our practice to be evidence-based. So it was interesting to learn that a lot of clinicians, occupational therapists, do not use standardized methods to assess mental health. Some additional questions and discussion that I still have after all of the research I've done. These are some questions I would want to continue to research. So one is what training is available for occupational therapists on how to address mental health? So what is already in place, or what do we need to put in place? How do we train clinicians on mental health so they can feel confident and are able to implement into their practice? So this kind of goes hand in hand with that first question is, so if we don't have training available already, how do we implement that so mental health is being addressed for all patients? The next one is what training is available for other mental or healthcare workers on how to address mental health. So this is along the same lines, but now not just talking about occupational therapists, but talking about all different healthcare workers. And then what is the best way to assess or address mental health in occupational settings? So just kind of researching and finding out. So it isn't addressed. How do we address it? What is the best way to address it? And then lastly, what are the rates of depression and anxiety after an orthopedic injury? So as I said before, traumatic injuries often lead to worse mental health outcomes. So I'm just curious, what are those rates of depression and anxiety in orthopedic injuries? So part 2, this is kind of an overview and answer to those questions. So yes, I am still interested in researching about orthopedic settings. I'm not sure if I still want to take the mental health approach or if I want to research some different areas of orthopedic care. I think the mental health approach is very interesting and definitely an area that I think we lack research and implementation of it. But I'm still interested to see if there's any other areas that spark my interests. I haven't ruled out any topics, and I want to continue to do research on all of them. I found all the topics and research questions that I worked on this semester were super interesting. There's a lot of information out there, so I want to continue to gain knowledge about all of those to make sure I find the topic I am most interested in. I also want to ask some questions to an orthopedic surgeon that I know. I think this would be a good way to get a better understanding of how he specifically addresses or doesn't address mental health in his practice. I think this will help with my learning and understand kind of how he goes about his assessments and treatment and how it compares to occupational therapy or how they can work together. And also get an understanding of why or why not he addresses mental health in his practice. And then I'm also interested in researching more on treatment for elderly with cognitive deficits, since I have personally witnessed the mental health effects of hospitalization and cognitive decline. So just really understanding and getting more research on how we can provide better mental health outcomes and treatment for the elderly, especially since there is a lack of empathy and patience usually with that treatment, and that elderly often report less satisfaction with their healthcare treatment. So that is it. I hope you guys enjoyed my research questions and findings, and I look forward to finding my final capstone topic and exploring more about topics I'm interested in.